Hello, everybody, and thanks for listening. I do know that some people are full aware there's an outbreak of the flu virus, and it is pretty dangerous this year in 2018. So, this article it's reading, it says, "Are you in danger of the 2018 flu in Los Angeles?" So, the numbers are looking pretty grim. This article was written by Lindsay E. Mack 8 days ago. So the flu outbreak is especially bad this year, and plenty of people are worried about their health. In some places, such as California, the effects of the year's flu appears to be even more pronounced. So, are you in danger of the flu in Los Angeles? And how can you stay safe from this year's strain? It's a concerning outbreak, and the effects are very far reaching. So this year's flu outbreak has hit many areas especially hard, including parts of California. For the week ending December 30th, 2017, 27 influenza associated deaths in persons younger than 65 were reported by the California Department of Public Health, which is abbreviated CDPH. By January 15, 2018, the flu death total in California has risen to 42, as explained in Los Angeles Daily News. This alarming number of deaths has resulted in additional problems for state. The ERs are packed with patients, and some California pharmacies have run out of medications, as reported by KTLA. So it's a serious health concern for many people, particularly those in populations that are most vulnerable to infection. And we're not even close to seeing the end of this epidemic yet. So I'm going to read that back again. It's a serious health concern for many people, particularly those in populations most vulnerable to infection. That brings a question mark, just hearing that. So, who are these populations that are most vulnerable to infection? Poor people, people who don't have health care, who lack health care? Could it be people that are coming from other places that we don't know? Maybe in the country where they came from, there was an epidemic and they bring that epidemic and transfer it over here to the United States and to Americans, and now we're suffering behind this epidemic. All of a sudden is become a bigger issue than it was before. The serious threat isn't limited to the global state either. As noted by the Centers for Disease Control and Prevention, which is abbreviated CDC, there's a widespread flu activity across much of the entire US. So this year's flu outbreak has definitely been very tough on many people. So as we know, the common cold, people would, you get your cold, you go through your cold symptoms, the runny nose, maybe you even have like a low grade fever. Some people will have that. Some people will have a stuffy nose. They take an over the counter medication, get some rest, maybe eat something they feel is healthy and that'll help them recover and build up their immune system, and then they're back off to their normal routine or daily routines. But not this year. It's not as simple as that. So, in general, the people who are most vulnerable to these flu outbreaks, what we've known of, it's been children that are younger than 2, adults that are older than 65 years of age, and pregnant women who are expectant, and immediately postpartum women, women who have just had children and their immune system is low because they were carrying a baby and the baby has used all their immunities and their nutrients. And so the mothers are now weakened and they have to slowly recover and build their immune systems back up. So they're wide open for these viruses. So it says that the residents of long-term care facilities also have explained by the CDC, which is the Center for Disease Control Prevention, people with many types of medical conditions. This includes people who have kidney disorders, weakened immune systems that may need to be on alert. People who also have other pre-existing health issues too. And they didn't really mention that in here, but I would I would bet that the numbers of those people are at a higher risk. It may also need to be on alert as well. So if you have any specific concerns about your vulnerability to the flu, you have to consult with your primary care physician. And they would give you a more tailored advice or detailed advice to your specific need. With the severity of this year's outbreak, it isn't worth taking any risk, particularly if you have a current health compromise. So if your health is already compromised, then you don't want to waste time wondering if you are at risk. If you do contract it, it says, why is the flu so dangerous in these instances? The question. Although most people who get the flu tend to bounce back after a couple of weeks of rest, people in these vulnerable groups, there's that word again, vulnerable groups, may be more likely to experience complications from catching the virus. So what I've known is viruses can't be cured. You have to let them take their course, and you have to do everything you can to build up your immunity and to build up your system so that you can withstand these viruses and bounce back from them and go on with your normal routine. But this is not happening for some people. What we've been seeing is kids that are over the age of 2 are getting this flu and dying of it. Adults who are not over the age of 65, they're not pregnant, they haven't just had a baby, but they're dying of it too. So now people are wondering what's going on. And it's been told to us that the vaccines that they offer that are free to these quote unquote vulnerable populations are only 20% effective. So these are the things that we're not hearing as well. So these raise questions. And who are these vulnerable populations? Who are all of them? Where is this coming from? This was right after we had that whole thing with the Zika virus. And you notice they haven't really said much about that lately. It's quiet now. And so we have this really, really bad strain of flu all of a sudden. These are the real threats, complications such as pneumonia, bronchitis, and even ear infections. And ear infections can get chronic. So they're sometimes serious enough that it puts people in the hospital, as further explained by the CDC. And in some instances, the complications can lead to the person's death. One should know that the differences between a cold and a flu symptom, they should know the differences. Sure, it's easy to think that the flu as a sort of super cold, but it often has a distinct symptom, which the common cold, for example, flu symptoms often have extreme exhaustion, severe body aches and pains and fever, and you can have a fever from 100 to 102 Fahrenheit, ranging for lasting for a few days, according to the WebMD. In addition, the symptoms that colds and flus have in common, such as chest pains, aches, coughing, tend to be more severe in the case that it is the flu, as further noted by WebMD. If you are in doubt, then take a trip to your doctor and they may be able to explain it in depth. So it goes on to say that if you have escaped all the symptoms of the disease so far, there's still time to protect yourself with a vaccine. And that raises questions because people want to know what's in the vaccine and is it really that effective? And like I said earlier, they said at one while they were saying it was only 20% and effective. And it's better to have a vaccine 20% than no percent. So you have a greater chance of withstanding these viruses. But what's in that vaccine? Where is it coming from? And who are the vulnerable populations? And who is really getting these free vaccines? Who are getting the free vaccines? Why are they running out so fast? Is it because this flu epidemic is a little bit more intense than what they're saying? Is it because the vulnerable populations could be people that we're dealing with right now, an issue of immigration? Are there people that are coming from other places that have illnesses that we don't know of, that they're not saying? These are all questions. Although the influenza season usually peaks between December and February, flu activity can occur as late as May, which means it is not too late to get vaccinated, said CDPH Director and the State Public Health Officer, Dr. Karen Smith, on the CPDH website. Getting vaccinated may be your best bet against this year's flu, so don't hesitate to get that shot. And if you are experiencing flu symptoms, early intervention is equally important, as the CDC stated that taking antiviral medications within the first 48 hours of catching the virus makes it most effective to fight off this flu. So this is the questions that I had raised. Who are the vulnerable populations? It's not just people younger than 2 and people over the age of 65, pregnant women, and people who have just had children. There are other underlying situations here. You know, they have the issue right now of immigration. They have the issue of healthcare and people not being able to afford healthcare. And so they're not really telling everybody all of the details. So I would just say, I will throw those issues out there, that maybe there's more to this and we're not being told all of it, because it'll create more hysteria, more panic, and probably more frustration with Californians already dealing with the rise of the issues of healthcare and the issues surrounding immigration, and people maybe coming to this country illegally and they have illnesses and they don't have adequate health care and they're not able to withstand these viruses, or they're carriers and they're bringing new viruses on top of the viruses that are already here in the States. So these are things that they're not talking about. And so I just thought those were some things that were important, that maybe people were probably considering as questions that should be raised, that they're not being honest. They're not telling everything because it'll create more, maybe more divide on political issues about these things that are happening here. So maybe if you are interested in checking out the article, you will see that these are real issues that have come about here in 2018. I have had some people that I know that said that they thought that they had a regular cold or the regular flu, and they wound up being out not just a week, maybe 2 weeks. And they couldn't move. They had pains that they couldn't believe, symptoms they had never felt before, that just threw them on their back to where they had to stay out. They had to take a leave, and they had to get antibiotics. When have we ever seen it this bad? And so these are questions raised. There has also been a time where people had stopped vaccinating their kids for fear of what was in the vaccination shots. And some were even thinking that they were giving kids things that were causing them to become autistic, because we had a rise of autism. And some might even argue to say, well, a lot of those things happen at birth, before the kid is even born. But the fear is rampant out there. There's so much fear people are not really trusting of these medical organizations and these pharmacies and what they're putting in the medicines. Look what's happening with the opioid crisis. So that is what is causing the fear of and the more frequent questions as to what's in these medications and vaccines. People want to know specifically if it's safe to take. Is it going to create a worser problem than they've already experienced? You know, they had commercials where they would have all these lovely medicines and tell you they're going to cure you of your illness. And in the fine print, they have more illnesses in these medicines if you start taking them. And so this is what raises these questions. And if you're working in a high risk environment, if you're a healthcare worker, or if you're an educator and you're working around small children, if you're a caregiver and you're working around people that are in hospices, or you're in maybe working in a home facility, and you know people who already have illnesses or pre-existing health problems may be at higher risk, and which throws those individuals who are giving them care to also be at high risk. So these are all the questions that are being raised in this time. So I just thought I would put that out there, make a video about that, because I know there's a lot of fear out there, and some people even historically don't really trust some of these health organizations that say we've got free shots and free medication for this. Because if you look back even in Black history, this is Black History Month, the Tuskegee experiment, where they had Black males. There was a Tuskegee syphilis study. So I'm just going to read about that real quick. Okay. So this is what scares people as well when you have these organizations. There's a Tuskegee timeline, and there are dates here. And some people are not really big on dates. Photogenic memory about certain issues. But in 1932, the Public Health Service was working with the Tuskegee Institute, began a study to record the natural history of syphilis in hopes to justify treatment programs for Blacks. It was called the Tuskegee Study of Untreated Syphilis in the Negro Male. The study initially involved 600 Black males, 399 with syphilis and 201 who did not have the disease. The study was conducted without the benefit of patients being informed consent. So researchers told the men that they were being treated for bad blood, a local term used to describe several ailments, including syphilis, anemia, and fatigue. In truth, they were they had not received proper treatment needed to cure their illnesses. In exchange for taking part in the study, the men received free medical exams, free meals, and burial insurance. So although originally projected to last 6 months, the study actually went on for 40 years. Okay? And so here it goes on to say that 1926, health is seen as inhibiting development, and a major health initiative is started. Syphilis is seen as a major health problem. Prevalence of 35% observed in reproductive age population. 1929, aggressive treatment approach initiated the mercury and bismuth. Cure rate is less than 30%. Treatment requires months and side effects are toxic, sometimes fatal. talks about some of the things that have. So it goes on, it goes on. In 1932, there's a follow-up effort organized into the study of these 399 men with syphilis and the 201 without. The men would be given a periodic physical assessment and told they were being treated. But Moten agrees to support study if Tuskegee Institute gets its full share of credit. And so the Black professionals are involved were Dr. Dibble and Nurse Rivers, who are assigned to this study. And so you see the people who are doing this right now. And so the paper suggests health effects are untreated syphilis. This was in 1934. So in 1936, major paper published, study criticized because it is not known if men are being treated. This is when they start suspecting these organizations. Local physicians are asked to assist the study and not to treat men. Decision was made to follow the men until their death. 1940, efforts made to hinder men from getting treatment order under the military draft effort. 1945, penicillin accepted as treatment of choice for syphilis. 1947, USPHS establishes rapid treatment centers to treat syphilis, and men in study are not treated, but syphilis declines. Okay, so 1962, beginning 1947, to 127 Black medical students are rotated through the unit doing the study. And it goes on and on and on. So there are people, if you go even down further, and remember this, that some of these centers, CDC, here it says, 2007, bringing it a little bit closer to where we are, commemorating the transforming and the legacy of the United States Public Health Service, which is USPHS, syphilis study at Tuskegee. Okay? So in 2004, the last U.S. Public Health Service syphilis, I'm bringing backwards, study at Tuskegee participant dies January 16. So that might have been somebody who they lived long enough. They went through that whole era when they were doing these studies. So it's entitled CDC Center for Disease Control and Prevention, U.S. Public Health Service Syphilis Study at Tuskegee. Okay, so I know this is about syphilis, but it ties into the fears that people have even with taking the flu vaccine. And so that is the reason why people are not really that sure what they're taking in these free vaccines that you say are to vulnerable populations. Who are the vulnerable populations? I've said that word multiple times in other videos. Poor people, Black people, Latin people, people who don't have a lot of money, people who don't have health care. Those are the vulnerable populations. They're not telling you this. And so that's what's going on. So I just thought I would leave that in video and put that in there because that is why you have the fear. It is validated. These organizations will tell you, well, take this shot, take this pill. What's in that pill? What's in that shot? What am I taking? Is it really curing me? Or is it giving me more of the virus? Or is it keeping me sick? Is it just a placebo? Sugar pills. You're experimenting. I'm a guinea pig. So people don't know what is going on. And then you have these videos floating around all over the place talking about depopulating the US and one world order, a new world order. And so that scares people. So they don't know. And then we've seen videos on the internet where they have these places that have these big tubs and they look like makeshift coffins. What is that about? Those raise questions with individuals. They're wanting to know, what is that? Are you preparing for a war? Is it because dirt is not going to go in there? Something else is going in there. So these are the things that people want to know. So I just thought I would leave that there because that was important, because I think those are valid reasons to have fear. You know, some people take things and they say, "Oh, it's not scary. It's not as scary as they make it sound. You're going to be fine." But you never know the way this world has been going lately. At first they were all hyped up about the Zika virus. They've gotten quiet. Now it's been on the immigration issue, the healthcare issue, and some of these other issues, and these deflector issues. And so I'm just saying, as a Black person, as Black people, by looking at the Tuskegee experiment, you know, Black people have had a history where, the healthcare industry has not been very good to us in the past with telling the truth. So I just thought I would put that out there to make you think. Thank you for listening. Bye.